Hello everybody, welcome to my YouTube channel, Homoeopathy Super Session by Dr. Jargus. Today we'll be doing the fourth part of J. challenge, the chronic miasm, Psora and Pseudo. Once again, Hahnemann reminds us that the word Psora conveys the most important meaning. So time and again, Dr. Hahnemann is reminding us about the psoric miasm, which is very important. Hence, it says it conveys an important meaning. Now let us see what important meaning he wants to say. It means that the disease is more than we see it on the surface of the body. That means whatever disease we see on the surface, that is not so. It lies more. You have to go into more deeper aspects of it. That is, it is internalized and the expressions are externalized. That means the main disease lies within, that is internalized, and the expressions are externalized, or you can see the expressions. The root cause lies within in the form of miasm. So the root cause of the disease is internalized and it lies in the form of the miasm. So the miasm is the root cause for all the diseases, especially the psoric disease. It may be latent for many years and can get roused into activity by some exciting factor like some injury or until something unusual happens. So the psora is in the latent state and it lies there for many years. But however, it can be roused into activity by some exciting factor like injury or something unusual happens. It also may be due to some joy, grief, fear, overwork, or some trifling cause which arouses the sleeping monster and the person falls ill. So these are the other causes also which could have an exciting or a precipitating cause which would activate the latent psora. We can live a healthy life, normal life, if we are endowed with a robust constitution and a contented mind. So we are in a good state of health if our constitution is robust and our mind is contented. That means what we have, we are happy with whatever we have. We do not want more, or we do not want any bad thoughts or negative thoughts which may activate the latent soul. We fall sick when we are overworked or fatigued mentally and physically. So when do we fall sick? When the robust constitution is overworked, is fatigued, there is stress and strain of modern life, and there is mental as well as physical fatigue or overwork which the person is doing, and the person falls ill. Even simple disturbances in the diet and regimen can bring the latent or sleeping psora into activity. So he also says that even some errors in the diet and regimen can bring about the activation of the latent psora or the psora which is sleeping into activity. When psora develops a local disease, it always relieves the internal turmoil. So whenever the local disease is there and psora is responsible for it in the background, it will always relieve the internal turmoil. So whatever internal turmoil is there, it is thrown out in the body in order to save some important organ and in order to save life. This internal turmoil is calmed down as long as no suppressive measures of the local symptom is done. This is very important, that the internal turmoil can calm down, or that is the activated miasm, that is the psora, it can again calm down, or it can again be brought back into the latent state, provided no suppressive measures are there, especially of the local symptoms. So the cause lies internal, the body is thrown, the body or the vital force throws it out on the external surface of the body on some non-important surface like the skin. So the local symptoms are there. So always when the local symptoms come, the cause lies internal. So he says that the activated miasm of psora can be mitigated as long as you do not suppress the local skin symptoms. The local manifestation assists the physician to judge the intensity of the psoric state. So whatever local manifestations are there, it will help to assist the physician about the intensity of the psoric state. That means if the local disease, it flares up, or the local manifestation flares up, you know that there's an active, strong psoric miasm internally in the body. And when the local symptoms gradually subside or they have a less intensity, you come to know that the internal turmoil of the psoric miasm is also lessening. When according to similia, the local symptoms disappear This is a sure indication that the internal cause of the disease is mitigated. So when you take a case and you give a similar remedy, then what happens? The local symptoms, they disappear. And it is a sure indication that the internal cause of disease is mitigated. So if the right medicine is chosen according to symptom similarity, according to the totality of the symptoms, taking into consideration the active miasm lying within the body, then the local symptoms disappear. So when the local symptoms disappear, this is a sure indication that the internal cause of the disease is mitigated. That is, the Psora is mitigated. The Psora is completely destroyed and health once again regains. And so as a result of which, what will happen? The Psora will be completely destroyed. And once again, the person will be in a healthy state. The perfect similia may not be possible to get due to mismanagement of the case due to suppression. Furthermore, it says that, however, if there is suppression taking place, then you may not get the perfect similia remedy because of the suppression. So when suppression takes place, the symptoms are masked. You do not get any characteristic symptom to prescribe on, as a result of which you cannot identify the perfect similia or the simillimum. This is true when strong medicines are administered with modern school of thought. So this is absolutely correct or true when strong heroic medicines are administered with the modern school of thought. So as you all know, the modern school, the medicines used are very harsh. It has the side effects and they used to suppress the disease condition. Thus, the bad effects of the medicines have to be counteracted before the similia for the original disease can be selected. So what you must do, you must counteract the bad effects of the medicine. Now we have to deal with the drug miasm and not the actual Psora. So when the patient is overdrugged, when he is suppressed because of excessive medicines from the modern school of thought, we have to think about the drug miasm and not actually Psora. So we have to first counteract the bad effects of the drugs, that is the drug miasm. In case of recent drugging, we must first give no medicines but modify the diet and regimen. So in a case where the case has been drugged with excessive modern medicine, we must not give any medicine but just modify the diet and regimen. By doing so, this in turn will allow the vital force to throw out the bad effects of the crude substances and the primary disease will become clear. So whatever bad effects are there of the crude substances, they will be thrown out and the disease will become much more clear. So out here, we are having a mixed picture, the original disease along with the side effects. So if you modify the diet and regimen, the bad effects of the medicine will disappear or will become less, and the primary symptom of the disease will become more and more clear. A true physician will not prescribe on pathological names of disease, but will go deeper into the case and identify the symptom of Psora or the present acting miasm. So a true physician is one who will not prescribe only on the pathological names of the disease, like the modern school of thought does. But a physician who is true will go deep into the case and will first and foremost identify the symptoms of Psora, or for the matter of fact, any other miasm which is active. So it could be Psora, it could be psychotic miasm, or the syphilitic miasm, or combination of any of these miasms. That's a complex miasm. In this way, the physician will select the similia which will destroy the miasm. So once you have identified which miasm is responsible for the disease and you're taking into consideration the totality of the symptoms, then the medicine which you have selected is the simillimum that will definitely destroy the acting miasm. The physician must also look out of reappearance of old symptoms which are probably suppressed and now they appear, taking the case to recovery. So the physician also must be observant and he must perceive that if there is a reappearance of the old symptoms, so any old symptoms, again, they resurface, it was there. Why? Because probably it had been suppressed. And once the old symptoms come out, you know that you're on the right direction, the cure will take place, the medicine was correct, it is going according to Hering's law of direction of cure, and the recovery will definitely take place. In psychosis, such symptoms may arise like irritability of the bladder, frequent and painful urination, ammoniacal odor of the urine, or highly loaded with urine. So if the psychotic miasm is predominant or it is very, very active, then these symptoms like irritability of the bladder, frequency, dysuria, ammoniacal odor from the urine, or urine highly loaded with urates may be seen. Thus, the first remedy should not be disturbed in its action, not until it has ceased to work completely. So whatever remedy you are choosing, let that first remedy unfold its action to the maximum and let the action continue. So do not disturb the action of the first remedy as long as it is benefiting the patient. Many of the troublesome symptoms disappear by themselves in a natural order in which they came, says Hahnemann. So whatever troublesome symptoms are there, or the old symptoms are there, which may again cause some trouble to the patient, Dr. Hahnemann says that just give some time, they will disappear on its own. However, if there are constant annoyance, so Dr. Hahnemann says that if they are of a constant annoyance, then a new prescription has to be made as the original prescription was not well chosen. However, if the old symptoms, they do not disappear, then you can find out a second best remedy and administer to the patient. And he also says that a new prescription has to be made because the first prescription which you have done was not a well-chosen remedy. In most of the cases, the high potency will do the necessary work without a change of remedy. So he also says that in more majority of the cases, if you give the same first remedy in a slightly higher potency, it will do the trick. So that's all for this video. Please stay tuned for more. The last part, part 5, will be coming up soon. I hope you enjoyed the video. Thank you very much.